Oh, you didn't tell me that.
Well, here I have Wendy, and we're actually doing a Zoom conference call. I'm in California. She's in Oregon because she's what's called a snowbird patient in our Palm Desert practice, and she came in to see us a little more than a month ago. You had some degenerative arthritis in your hip and your spine, and we decided to do the laser cell signaling at that point. And 1 month later, how's your hip? How is your back doing?
Hip is clearly very improved.
Wow.
I was to the point before where I could hardly step up onto a curb.
Wow.
I mean, that's like what, 3 or 4 inches?
Yeah, yeah.
And I'm now almost pain-free. I have little twinges now and again, but it's really very, very good.
Were you ever told you needed hip surgery?
No, but I
Okay.
have a feeling that was coming down the road.
All right.
I was actually on prednisone for 10 years.
Wow.
And
Wow.
yeah, yeah. So I've been told that that's very damaging to your joints.
Yeah, it kind of it erodes it, it eats it away, and it makes it go bone and bone fast. But it looks like you can start weaning yourself off of that. All right.
Oh, I'm not there now. This was a long time
Oh,
ago.
perfect. Yeah.
This is when I was in my 20s.
Okay.
So I'm not, oh, good Lord, I would never do it these days. I'm smarter than I was then.
There you go.
So, and actually the doctor said that he thought this was bursitis in my hip
All
as
right. Yeah.
opposed to, but whatever it was, it's much, much improved.
All right.
The back, not quite as much, unfortunately,
Uh-huh.
but I'm having a harder time defining improvement on that. Um, I've had problems with it for so long, it just sort of wears me out.
Okay.
It's more of a chronic, ongoing pain rather than the sharp pain that I had in my hip.
Okay.
Um, I can now be up and about longer before I have to quit and take a break.
Yeah.
So that's a definite improvement.
Great.
But I still do have pretty much the same level of pain once I get there. But it
Okay.
might be an hour as
Yeah.
opposed to 10 or 15
The
minutes.
frequency is less then.
Yes,
Okay. Now,
yes,
if you had to put a number, Wendy, on the hip pain improvement, what percent would you say the hip is improved? If you had,
90,
wow.
90, 90%.
Yeah,
Yeah.
usually hips, they respond slow. Remember, I told you 10% improvement a month, but it's been a month and you're already 90%. That's
Yeah.
awesome. And
It's amazing.
the back, how many percent improvement if you had to put a number?
That's what I'm saying. I'm having a harder time with it because it's not
How
quite
about
so.
percent of less of the duration of the pain?
Well, it's not duration as much as onset. It
Okay.
takes longer before it starts bothering me.
Okay. Well, that's fair.
So
Yeah.
I'm going to say maybe 40 or
Well,
50%.
well, that's still 50% incredible after only 1 month. And like I said, give it a year to get
So I
more.
can keep seeing improvement.
Exactly. 10% improvement a month, but you're way ahead as far as the hip and back. So when are you coming back to the desert?
I'll be back the end of September.
Perfect. And then we'll do a live reevaluation. We'll go from there.
I'd love to see your picture again. You know, your
Yeah.
heat, your
Yeah, we
your
can compare the
blood flow.
inflammation and blood flow, and
Yeah,
make sure you're doing your light stim, okay?
absolutely.
All right.
Now,
Um,
will I continue just doing that forever?
well, once your pain is pretty much relieved long term, then we can start tailoring that back, okay?
Okay.
Well, Wendy, I'm glad you're doing great up there. Stay cool up there in Oregon. We look forward to seeing you back in the fall. Congratulations.
Thank you.
Yeah, just schedule your next evaluation with Melissa when you're back, okay?
Okay, so I don't need to do anything till I'm back in town.
You're all set. You take care.
Great. Thank you so much.
Bye bye.
Okay, bye.